Hi. I'm here to talk to you about possible causes of frequent urination. There are a number of health conditions that can cause frequent urination in men and women. This is a symptom that can even begin so gradually that it may go unnoticed for weeks or months. It is very important that you know what types of physical problems may be creating this disorder. Individuals with frequent urination problems find that they have to go to the bathroom much more often than normal. Instead of emptying their bladders completely, it may also feel as though there is still urine remaining in the bladder after they have finished using the toilet. Instead of urinating an average of 6 times a day, a person may go 10 to 12 times, or even more often than this. While normally a person can go to sleep and rest comfortably for 6 to 8 hours, those with urinary frequency will get up a number of times because they need to relieve the feeling of urgency that is being triggered in their bladders. UTI, urinary tract infection. This is without doubt the most common of all reasons for complaints of frequent urination. UTI is triggered by an infection that first begins in your urinary tract. This infection is usually caused by bacteria, and as it inflames the sensitive tissues in the urethra and bladder, it causes pain, sensitivity and urinary spasms to occur. Diabetes. Frequency in urinary habits is a classic symptom of diabetes. Frequent urination in this instance is your body's way of trying to get rid of excess sugars that are accumulating. Excessive thirst is another symptom that can develop with diabetes. The extra fluids that are being consumed to quell the thirst mean more fluid your body must eliminate. This will also create an increase in your urinary habits. Prostate problems. For men, the problem of frequent urination may be related to a prostate condition. Males 40 and older must frequently deal with an enlarged prostate gland. If this condition is present, it can irritate the bladder and create the urge to void every 1 to 2 hours. Pregnancy is another reason that many women may experience bouts of frequent urination. The weight of the enlarging uterus exerts pressure downwards onto the bladder. As the bladder becomes more compressed, it will trigger an urge to void. Some women may feel the need to empty their bladder every 1 to 2 hours, or perhaps even more frequently than this. Medications. For some people, it is easy to link frequent urination problems to the medications or over-the-counter supplements they may be using. Some medications and vitamin supplements have a natural diuretic effect. In this case, a drug such as Lasix can compel your body to eliminate excess fluid for health reasons. Vitamin C is a natural diuretic, and it has been known to cause more frequent eliminations if the supplement is being used in large amounts. Other contributing factors. Bladder damage can also be a factor that is causing frequent urination. Conditions such as nerve damage, weakened urinary muscles, bladder cancer, or even a prolapsed uterus are some of the other reasons that may create increased urination. Caffeine and excess fluid consumption are 2 other reasons that a person may notice a frequency in their need to urinate. In some cases, the cause of urinary frequency may be easy to identify. It is still a good idea to talk with your healthcare provider about this problem so it can be properly addressed. The sooner you get an accurate diagnosis and treatment, the sooner this condition can be resolved.